Okay, Chrissy, so we're going to talk about stretching today.
Yep.
I always think of stretching as the part of my workout that I notoriously skip,
Yep.
but I do know that it's important. So tell me about why stretching is so important.
It's kind of the part of the exercise routine that no one wants to do, but it is definitely important. It helps work on our flexibility. The better your flexibility, the better your body is able to go through the motions it needs to when it is doing your exercise. So the more you stretch, the more that more flexibility you have, and the less chance that you're going to have injury or anything go wrong during your exercise.
Right. So I know that there are different kinds of stretches, static and dynamic.
Correct.
Tell me what the differences are.
Yeah, static stretching is more your traditional stretching, what most people think. So
Right.
the static stretch would be held in a position for anywhere between 30 and 90 seconds.
Right. The kind I particularly hate.
Yes, and no one wants to do. Exactly.
Right.
A dynamic stretch is one that you do more fluidly. So what you would do, for instance, if you want to stretch your hamstring, what you would do is one way would be able to swing your leg out and then back, and you don't have to hold it in a position. So you just go back and forth, you use momentum and your muscle power to stretch that muscle out.
Okay, and is that more the type that you would do here, or do you do both?
You do both. Dynamic stretching has been shown to be more useful before you do your exercise or your athletic event. Many different reasons for that. One is it warms up the muscle as you're stretching it, so blood flow is going to the muscle. Your core temperature is raising, so again, you have less likely to be injured during your exercise. Also, you're warming up the muscle in a way that you're going to be using it. So, for instance, if you're a runner, you're always going to be stretching your leg and then relaxing your leg, stretching your leg and relaxing your leg. So the dynamic stretch, you'll be able to stretch that muscle and get your body used to doing the exercise it was supposed to do.
So then why would you choose a static stretch?
Static stretches are better at the end of your exercise. Your muscle is already warm. It's been used throughout your exercise. So if you do that static stretch at the end, you'll again work on that flexibility.
Okay.
There is some studies that showed actually too that static stretching is not very good before your exercise because it could actually decrease your muscle strength for up to 60 minutes after you do that static stretch. So if you are going to do that static stretch and then be very physical, you can actually be predisposed to injury. So dynamic again is better before, static after.
So is this a type of, is a stretching program something that a physical therapist could really set up for me? Because not really knowing how my body works in that way, I think I would be afraid to try to set up a program for myself.
Yeah, definitely, especially if you've had an injury or you have a body part that's predisposed to just keep getting re-injured. Physical therapists could definitely set you up. We could evaluate you, figure out what muscles are tight, which ones need to be strengthened a little bit, and then we could show you different variations of exercises that you could do both dynamically and statically, so hopefully you'll be less likely to injure yourself in the future.
What if I haven't had an injury, but I know, for example, that I am a runner, that I'm a marathoner, for example, and I just really want to be sure that I don't injure myself. Can I go to my physician and say, look, I'm a marathoner, I want to be sure that I set myself up to avoid injury. Can you write me a referral to a physical therapist? Would they be able to do that for me?
Definitely, that's exactly what you would do. Contact your primary care physician or any other specialist you're seeing. They could write us a prescription, and like I said, we could evaluate you, tell you what you need to do to hopefully prevent those injuries and get you ready for that marathon or whatever you're doing.
And we should be sure to note that here in Indiana, you do have to have a physician's referral to come in to IPT. So, but it is that simple, just to be sure that you get the referral from your physician. It's not a big process. It's just a step that you have to take first.
Exactly, unfortunately. But yes, just get that referral, and then you could contact one of our offices, and we could get you scheduled.
So you guys have great hours and several locations, and once you come in, the therapist can get you set up on that stretching program. Like I said, it is my least favorite part, but once you get into it and really start working on that flexibility, it is something that...
It gets easier and easier the more you do it. And like I said, it doesn't have to be something that you're stretching for 30 minutes. We could get you in a nice concise program, get you going.
And it's a program that you can set me up on that I can work on at home.
Definitely.
So that I'm not in the office several times a week every week.
Right, exactly. Yeah, but it'd be easy to do at home. You don't need a lot of equipment. So
fantastic. Well, Chrissy, promise I will start to work on my flexibility. I know it's important. And like I said, a flexibility program isn't necessarily something that you need to do post-injury.
Nope.
You can get yourself started before that injury happens. But certainly, accidents happen, and you can come into IPT if that does happen. So be sure that you go to your physician and get a referral, because you have to have that, unfortunately, first. Tell them that you want to come into IPT and get on the road to recovery or prevent those injuries first. Stretching is important, so be sure you do it. Check out IPT today, and we will be right back on Insight.